Hello everyone, in this video we are going to talk about diabetic ketoacidosis. Diabetic ketoacidosis is a medical emergency. Now it is a characteristic of type 1 diabetes mellitus. It is commonly seen in the patient of type 1 diabetes mellitus. It is often presenting problem in the newly diagnosed patient. Now what is the pathophysiology of the DKA? So the problem arises because of the insufficient insulin. Now, because of the insufficient insulin, there will be decreased glucose uptake and utilization, increased glycogenolysis, increased proteolysis, and increased lipolysis. So, there will be glycogen breakdown, protein breakdown, and lipid breakdown. Due to glycogenolysis, glycogen will convert into the glucose. Proteolysis will cause increased amino acids, which will go into the cycle of gluconeogenesis. Lipolysis will cause increased free fatty acid, which will go into gluconeogenesis and ketogenesis. Ketogenesis is increase in the ketone body production. Ketogenesis will lead to metabolic acidosis and it will cause increased lactate. Now this whole process, because of the decreased glucose uptake, glycogenolysis, proteolysis, whole gluconeogenesis, there will be increased glucose in the blood, which is called hyperglycemia. Hyperglycemia will cause glycosuria, which will lead to osmotic diuresis and dehydration and electrolyte loss. So there are three main things in the pathophysiology that you have to remember. First, hyperglycemia. Second, ketogenesis. And third is metabolic acidosis. This all will lead to osmotic diuresis, dehydration and electrolyte loss. Now after the pathophysiology, let's understand the cardinal features of the diabetic ketoacidosis. So cardinal feature first is hyperketonemia or ketonuria, hyperglycemia second and metabolic acidosis. So because of these three cardinal features, the majority of the symptoms arises. Now, how do you assess the patient of diabetes ketoacidosis? So, clinical assessment is based on the signs and symptoms. Now, what can be the symptoms of patient of diabetic ketoacidosis? So, symptoms can be like polyuria, thirst, weakness and weight loss, nausea, vomiting, leg cramps and blurred vision, and abdominal pain. Now, this abdominal pain is more commonly seen in the children. Now, what are the signs of diabetic ketoacidosis? So, sign is first, there are signs of dehydration, like there is loss of skin turgor, furred tongue, cracked lips. There will be hypotension. Now, why there is hypotension? So, because of osmotic diuresis, there is loss of fluid from the extracellular compartment, which will cause decreased blood volume, which will lead to fall in the BP. So, hypotension. Next is Kussmaul breathing. Now this Kussmaul breathing is rapid and deep breathing at a consistent pace. Smell of acetone from the patient, tachycardia, cold extremities, delirium, drowsiness or coma. So these are the signs of dehydration, hypotension, Kussmaul breathing and smell of acetone. These four are the main, and then there is tachycardia, cold extremities, delirium and drowsiness or coma. This is all about signs and symptoms and pathophysiology of DKA. We will talk about the investigation and treatment in the next part. Thank you for watching.